Hello everyone. Let me give you an insight to the operation management of healthcare services. Today we are looking at more of how to organize a clinical services, and of course the whole module would cover the gamut of things. But what I'm trying to do today is to give an introduction to just operation management, and then the key issues that in today's environment, and then the basics of healthcare service operation management planning, and then to allocate resources and what are they. This is just to give you an insight to the tools and techniques that are available to improve operation management. If I ask you to draw an effective medical administrator's picture in an office, what would you write? Try a bit before you move any further. Pause a bit and do it, and then you would see what kind of a people that you have seen. Is a guy with more of a files in front of him, or is a guy with nothing on the table, or is a guy with a lot of graphs and charts around you. Um, it all depends on how you manage your operations. So that's very important to see what you have around. Um, so if you look at the operation management, it's just that process providing desired output and outcome from using resources, and then there's input definitely, and there's the output. For example, examining and treating 100 patients in a hospital within 6 hours with a cash flow of 40,000 rupees whilst satisfying 85% of the patients. So this is basically we are looking at not only there's a target of 100 seeing 100 patients, there's a time limit of 6 hours, and there's a cash flow output, and then of course the outcome of the satisfying the patients. This is basically a responsibility of a hospital administrator. If you look at the a definition, basic definition is a management of systems and the processes in any organization to create goods and services. So basically, you know what the goods are, you know what the services are. I'm not going to go into more details on this, but if you get basics characteristics of goods and services are, goods are mostly tangible, you can feel it, and services are more of intangible. But the more important thing is we do more services in healthcare, and its customer contact is very high, labor content is very high, uniformity of the input is not it's low because it's generic for everyone, and then it's not a unique shirt that you're going to wear. That's what it says. And measurement productivity is extremely difficult in services, especially in healthcare. An opportunity to correct problems and delivery is fairly low in services. Inventory is very little inventory. Wages are wide range depending on the resources that you use. Patentable, not usually services are not patentable. You have inputs, and then what you do is you transform these inputs to output, and you have a feedback in different levels by monitoring. In a typical process, this is a very simplistic process. You have input and you have output. You transform these inputs to output during the patient care process. And if you look at the hospitals, of course, what we do is our inputs will be patients and the medical supplies and the resources, and the other component resources could be doctors, nurses, and the equipment. And then we create, transform healthcare services, and then desired output would be healthy individuals. Um, uh, Let me go to the key issues in operational management. You will get a more detailed analysis of this in the other modules. The resources will give you insight to this. Basically, economic condition variations, innovation is a prime component. Quality issues, risk management, especially in healthcare, competing with the global economy, and environmental concerns, and ethical conduct, and then managing and the supply chain. These are basic operational management issues. I will skip this, and you can slowly read some of these. I come to my main topic is an overview to health services operation management. If you look at the difference in healthcare in the other services, The whole focus is to minimize risks and providing high quality of care. The risks are extremely high. Input the patient, and they can go and end up in anywhere once you complete the healthcare process. Therefore, the high risk levels are extremely high. So we have to reduce that risk levels. And then the patient satisfaction. I mean, how can you satisfy the patient? It's extremely difficult in with the risk elements and the standards, how you can satisfy the patient, but our ultimate goal has to be that. And then bonding and ensuring repeat customers, you treat them well, that they will come back to you again when they have a problem. Because healthcare is a very dicey environment where you can't really market your products because of the ethical arena. Um, they promote through the word of mouth, and doctors and staff satisfaction. That's very important. Doctors and staff, the staff satisfaction is also important. And now, whilst doing that, you have to manage the assets. You can't just idle an MRI machine or the CT machine, highly costly machine. You have to use it as much as possible. The productive use of human resources. How will you use them maximum and by multitasking, and how you use them to your benefit. And of course, the supplies. You don't waste things, and creating a most cost effective services, putting little bit of money and getting the better yield from. And then the forecasting, that's and the question, my answer to my question is, you have to have an administrator who have not the past records, he should have the future records. How many patients are going to come into his hospital, and what are the numbers that he expects. That's what a good administrator would have. And nothing on the table. Of course, the activity level, you can have things on the table, but the background, he should have these forecasting, patient care forecasting graphs. Then the systems management. How will you improvise the system, hospital as a system? I'll get into that in a while. How you manage your system efficiently. If you look at the hospital, you have the core clinical services. That's a major component why patients are coming. But you can't run clinical services, core services, without the support of the support services. What are the main components in a hospital? If you really look at, we have patient care services, we have OPD care, outpatient care, investigative care, then we inward care, and then high dependency units like theaters, ICUs, etc., health information units, rehabilitation units, and pharmacy. I think we should put the research as well there, and the training. Those are the basic components in a clinical setup that we have. And support services would have administrative, financial, and facility. If you look at the first support services, administrative, managing clinical services, that you will be one day managing the clinical services. That's general administration of the support services. And then, of course, marketing and promotion, medical records, legal activities, media, managing media, CSSTs, blood banks, infection controls, and quality management. All this will come under the health administrator's role. Financial services are important. You have to have accounts department where you get the cashiering, banking, auditing, and of course, generally we keep the IT department under accounts department simply because to control controls are better with them, and of course, managing outsourced services are also with them. And then managing supply chain is an important component in financial services, where the medical, surgical supplies, consumer, and then non-medical and general supplies, all that are ordered and managed by the financial unit. When you look at if you look at the facility services and public relations is a prime important in any hospital or any health service element, and then the room services, laundry, diet services, janitorial, and landscape, security, and transport. Those are important components in any hospital support services management. And also facility engineering, because the whole is like a hotel. You'll have to manage the facility where the civil constructions and repairs, and mechanical and engineering like water and sanitation, electricity, AC, sewer treatment plants, lifts, fire and gas supplies, maybe medical and non-medical. All these are under the facility department. Let's look at the clinical services. When you're looking at the processes, when you look at the system or operational management, it's nice to look at the first clinical services, then allocate the resources accordingly. Um, so, what are the hospital? We have preventative care, investigative care, curative care, rehabilitative care, training, and of course, the research. This is the main component of any hospital. And we have a direct services in OPD. You have channeling, consultation channeling, or the consultants consulting general specialties or supra specialties like cardiothoracic and etc. Or GP practice, vaccine clinics, wellness clinics, fertility clinics, pharmacy, and indirect services are the outreach services. You use the hospital as a base to provide outreach services like home care, home investigation, and patient transport. Investigative care includes medical laboratory, radiology, cardiology, audiometry, ophthalmology, neurology, endoscopy, gamut of stuff that you know. Then inward care will be, there's a day care. Typically, we keep patients maximum about a couple of hours. Preliminary care units where we keep the patient until you make a diagnosis or triaging them. Then the wards, in wards, you have rooms and pharmacies. The high dependency and critical units includes accident and emergencies, and then intensive care units, medical or surgical, and neonatal care units, operation theatre, labor rooms. There's many other elements coming into today's. These are generic ones in high dependence units. Then you have rehabilitation, physiotherapy, speech, drug, alcohol abuse, physiotherapy, psychotherapy, wound care and stroke care, many. Just look at this activity, read a bit. There are enough reading material provided to you. I would ask you from how to overcome the current obstacles in hospital operation management by using general operational management strategies with a view to move towards organizing a best operation hospital in Sri Lanka. To answer this, let's look at the other elements. Let's get into the basics of healthcare services and operational management planning. The basics are you look at currently what is happening now, and you are going to look at what's happening in the future from here to there. That's called the basics. Initially, what we do is we have to forecast how many patients and what are the capacities that we need to organize those patients, patient care services. And then whilst doing it, you'll have to look at current processes, how the patient come in and how will you treat them accordingly. That's called a process management. Then you place objectives. Then you look at how many patients you are going to see and what are the financial benefits you are going to get for the hospital. Then according to that only, we will allocate resources, looking at the cost of the care, maintain the quality, how much of outcome you need, and how to maintain the output that you need, and what is the desired outcome of these particular processes. Then, of course, you put systems and monitoring mechanisms or organize the policy structure, implement operations, then manage variations. And managing variation is called tactical planning. If you really look at the planning process, you may have undergone the strategic planning process where we did the strategic planning, the long-term plan. That's about 3 to 5 years plan for an organization. And then those 3 to 5 year plans are divided into annual plans, which is called operational plans. So in between, when you organize something and there's a variation, you get a feedback, you change that, it's called a tactical planning. So that's in between, right? So we basically what we do is we do patient care forecasting first, and then study the patient care processes, then planning the resource requirements, as I told you before, then organize the operational policy framework. Then you implement the service plan, and then monitor the plan, evaluation the plan, and then of course feedback, and then tactically you change the processes. I'll go again. First, what we do is we plan the hospital services through patient care forecasting, and then study the patient care processes, what's happening now, and then plan what are the resource requirements in order to organize the future plan that you need, and then implement the service plan, and then monitor the plan and evaluate the plan, and finally feedback, and then change your process accordingly. When you look at the patient care forecasting, there are many methods, and it is hardly done in most of the healthcare systems. But time has come for us to really look at the patient care forecasting. How many patients we can't get in different categories. It is extremely difficult activity, but there are many methods available now. If you go to Google, you have many methods that you can forecast, maybe plus or minus 20% certainty. You can say these are the patients we are going to come. Because otherwise, you're just waiting without any plan. You try to allocate patients, allocate your resources, just waiting, and suddenly you get a shock of your life. Suddenly you get heaps of dengue patients. You are not ready for that, because you are not then you have your planned surgeries. You'll have to stop, because these patients would stay in the hospital for about a week, maybe a couple of week or two. So then what will happen is your hospital is going to be overcrowded, but you can't have the revenues, and you can't have the other activities going on. Therefore, it's very important to forecast your patient plan. So there are different methods. I'm not going to go into details now. It's a separate entity altogether. There are few methods that first you have the goal of the forecast, and then you look at the time horizon, and then you select the forecasting technique, then conduct the forecasting, then monitor accuracy of the forecast. There are different types of forecasting: judgmental forecast, time series forecast, and the techniques of averaging. So you can go to there are enough resources for you to look at. So this is very important. Second stage, once you forecasted your numbers and the different specialty cases, a type of cases that you are going to have, then you look at the process currently what you have in order to manage them in future as well. So patient care process management is an important element. All of you all should know how to do a patient care process management, which will be important in many aspects, not only looking at the operational management, but looking at every step of patient care process. So basically, you have the inputs, as I told you before. You transform your inputs to output. And here in patient care services, more important thing is not just giving a drug, but you really have to look at whether the drug will work. So the outcome is an important element in healthcare. If you look at the basic definition of process management, it's a systematic series of activities. It's a very systematic series of activities where there's you organize that to achieve a goal. So basically, you transform your resources to your inputs to outputs. So if you look at the foundations in a process management, leadership is important, quality is important, customer orientation important, and that alignment with the organization objectives is important. Let's look at the leadership, because basically a manager always look up or look down. You look at his boss or look down. But main objective here is how you look at the leadership comes the alignment of the patient care process with a very smooth process. The leadership is very important, that they would push back all the processes very smoothly as your requirement. So basically, they would look at not looking up and down, but look at horizontally in terms of the process, right? Secondly, the quality management is very important. Every process, you look at the efficiency. That's how you allocate resources, how you get the maximum out of each activity in the process. And then, of course, cycle time, how fast you do it, efficiency, and the cycle time, right? And then the cost. So these are the three things we look at: efficiency, cycle time, and the cost of each activity. Then the customer orientation. So whatever you do, you're doing with a human being. So that there's a major component. The pressure comes from the customer, because they're at the end of the day, they're the ones who are receiving your services. So that all the processes should be built around the customer, not around the hospital. If you have more patient-centric services, if you're creating more patient-centric services, build it around the customer. Don't forget that. Finally, the organizational objectives. So whatever the things that you do, you have an objective, because we have the numbers to see, we have the types of patients to see, we have the financial obligation that you have to adhere to and achieve, and also you have a quality management, managing quality of all these processes. So therefore, that's very important. Then let's move into the process analysis. So basically in the process analysis, we will look at what to be done. So what we do is, first we measure and identify the gaps in the process, right? First we define the process, then we map the process, and then analyze the efficiencies and risks, then implement whatever the process plan, and then review and do the needful. The first one, identifying the operational gaps. It's very important to prioritize the operational gaps in a broader sense. Like, for example, so initially you look at, before you get into the process, studying the process, look at the market analysis, customer care services and market service, in-house data, the retention rates of the staff, the waste, inefficiencies. You have an idea before you go into this, because you can have a basic chats or look at the reports before you try to assess the process. Basically, we look at the starting and end points of each process when the patient come to OPD, the registration to the registration, and then the payments, and then consultation, treatment, and the discharge. So all these big activities could be looked at one by one. If you look at the hospital as a system, we get sick patients, and then we use resources. That's important. That's the input. And then during the process, what we do is, the service units will transform the patient to a well-managed patient, and then we use resources. So this basically input would be unwell customer, and we'll well-manage patient at the end. There will be other people walk in, health screening consumer, then we do investigation and inform them well. Referred patients, manage the patient and back referral as well. Health information seeking customer will be well informed customer, and of course home care customer, well managed patient. So these are the basic typical processes that we do in an overall output of a patient. Hospital functions in a very dynamic environment every time, every minute. Internal and external, both environments are really moving, and the hospital really get pressure from all these internal environment as well as the outside environment. So so in a hospital typically has two main subsystems. As I told you before, there's a patient care subsystem, and of course the support care subsystems. The core system is the clinical, and then support system just outside. So let's look at one of the subsystems. When you look at a hospital, so we categorize the main functional areas in the hospital. Like OPD is a one department, and inward care is a one department, and theatre complex is a one department. So you categorize initially what are these departments are, where there's a clear input and a clear output. If it's a continuous care, it's extremely difficult. But if you look at the OPD patient will come to the OPD and go off. Inward patient get entered to the inwards, and then they get discharged. So there's a clear input and output. And then these are called functional units. So in a functional unit, basically we have patient. If you really look at so what we do is, typically there's a patient care process and there's a facility process, as I told you before. So the processes are set of logical related tasks to define outcomes. So initially, this functional unit have a main functions. Each function would have activities, and each activity have small tasks. So let me give you a brief on this. Basically a function, if you look at functional subunits, if you look at in the OPD, we can categorize functional unit as the reception is a functional unit. There's a clear input, clear output on the reception. And then the registration is a functional unit. Then the payment is a functional unit. So each reception, each functions would have activities, right? Sub-function, OPD. Functional unit, if you take the reception, there is an activity. First, they'll have to greet, then they register, and then direct them into the payment area, right? So therefore, you have functions. Let me rephrase again. You have functions in a first you identify the OPD department, then you categorize the functional units in that department. So functions would be reception, registration, payment, right? In the OPD itself, if you take that, and then the consultation, and then the investigation and the discharge. So basically, these are called functional units. So each functional unit you have to divide into activities. So greeting, registering, and directory. If you look at the payments again, greeting, uh, receiving the payment, issuing a invoice to the patient, and then directing. And then if you look at the consultant area, again the greeting, again maybe a small registration there, then the consulting is there, consultation, and then investigation is there, and then of course they could be discharged after treatment is given in the pharmacy. Then each of these activities have a teeny weeny tasks. For example, greeting activity. Greeting, if you take the greeting as an activity, the presenting, how you present yourself in the hospital, what are the things that you wear, your uniform, badge, etc., and your hair, all that has to be come in. Then you greet. How will you greet? It's a good morning, good afternoon, and introducing yourself. And how will you identify your customer? Is it sir, madam, or mother, father, what? So that's very important. So you have functions, you have activity, you have tasks. Once you categorize them properly as a process, then you know exactly what is happening there. If you control the task level, you can control the whole process. So it might take a little bit of time. You might need some help from the seniors or the other staff. But if you do it, you'll be very confident in this. Not only the operational management, quality management, resource management, even a design a hospital, you need to have a process analysis. So let's go into the mapping. So we looked at the functions, activities, and tasks. So what we do is initially gather the basic flow chart. You can do it, right? So identify the system of the hospital, subsystems, functional unit, activities, and tasks. So you draw a functional activity area. You use a small line diagram, and then later on, if you want to use a process symbols, you can tell you that. So you have so basically go through this. Like for example, you can draw a reception, the payment, consultation, investigation, pharmacy, and bonding. This is the OPD diagram, functional areas in the OPD. So under each functions, I told you there are activities, and then each activity has some tasks. So you have to write this down, and you have to really look into that. And what we do is you can use within activities what's happening. These symbols could be used if you really want to do it, not necessarily. But if you want to use this, you can use this. Then you can do an activity on go to operation theater. Just look at identify the functional areas, identify the activities in each area, and then do the tasks. So this is very important. This exercise is for you to very important. At least major ones, like do it in the OPD, do it in the ward, and of course go and do it on the investigating unit because it's common in all, and then high dependency unit. If you do that, you get an understanding to think in a process mindset. Creating a process mindset is important for you to manage the processes, manage a hospital. If each tasks that you manage will get into an activity and a function and a department, and then all departments together, you managing a hospital. That's what's the role of a medical administrator, health administrator. So therefore, if you don't know these small units, how are you going to manage? So therefore, please do this activity. It's an important one. And of course, if you have any questions, just email to us. We will support you. So once you identify the the processes, each place you can put your space, how much of space you need. Now you know your patient care process. You know you get about 100 patients, maybe 400 patients for a session, maybe from 4 to 8. Yes, let's look at a private hospital or a government hospital, 8 to 4. So let's say 400 patients. So how am I going to get them in? So they will come in, let's say per hour, maybe if it's 4 hours, 100 patients per hour. So you need the space only for 100 patients. You have to average 100 patients, but they don't come in tandem. They will come one after another. They won't come in together. So you need to organize that space. Then to manage 100 patients within an hour, how many receptionists you need? How many cashiers you need? And then the equipment. What do you need? A table. What's the size of the table you need? How many people are going to sit in that table? And how many computers you need? And then of course, to control this, the other supplies you need, the invoices, etc., and display units, all that you can use. And then this is how you control your operations. It's very simple, isn't it? But you have to do the ground level, doing a proper process analysis. And then you have protocols, each of the protocol, and you can control the whole of the process. For example, now I'm wearing a tie and a long sleeve shirt. I have already cuffs have been folded because these days, because of the COVID, you're supposed to clean your hands. So that is the code, that dress code that I wear at the moment to fulfill the today's environment. So your uniform is written in the protocol at the task level, your presentation, how you present, how you greet, how you write down, how you address people, how you communicate with people, how you enter things. So everything is controlled at a task level. So once you control the task level, of course, then you can manage the whole organization. So next would be the looking at the non-value added services. You can now, once you do the processes, you can observe and see what are the places where it takes more time, more fatter the curve, fatter the processes, because there's stagnation, bottlenecks, red tapes, people go off. You can then really look at all these, look at the customer, measure time. It's called cycle time. Each time how you patient move in, right? Obtain average time taken, and then look at the customer satisfaction each unit. What are the efforts given by the staff? It's very important. What is the output in each unit, and for the resources that are needed to run that unit. Those are the things you look at, and then you look at it's a cost benefit analysis. What kind of a cost that you put, and what is the benefit you have? Can you change it? Can you make the efficiency better? Some unwanted thing, can you remove it, eliminate it? Can you reduce certain things? Or if you need a space or whatever, can you increase it? Now you can do it, right? Ask questions. So there's a thing called a BPR, business process re-engineering. That's the change that you do. You can change the processes, you can change the space, you can change the layout. All that could be done once you do the process mapping. This other activity could be once you do the process mapping, observe it and then look at the time taken, cost of each area. You can cost the number of staff that you used, the resources that you use to produce that output in that particular functional unit. You can look at it. Then you can look at the whole department, how effective the whole process is. If the patients do they adhere to the standards, if the quality standards, or what's the patient response or the satisfaction. Then of course you place the objectives. Once you know the process, to get back to you forecast the patients, and then you look at the patient care process flow, and then you place the objectives. Then now I know how much I can produce in each of the processes, each of the departments. Then you put at the budget numbers, the finance revenue, or the cost maybe. If it's a government sector, if it's a private sector, okay, we call it cost and the revenue. And in the government sector, it's only the cost. and now put some numbers, how many patients we are going to see in each of the places. Then allocate the resources. So basically, the resources, infrastructure resources, the human resources that you need, equipment, supplies, methods, and information. Methods, of course, comes as the policy structure later. If you look at the infrastructure, it's very costly, the hospital buildings, and very complicated services. And for example, to build a clinical infrastructure in an average general hospital, you have to spend about 20,000 rupees per square foot versus about maybe about 10,000 to 15,000 in a general building, right? And there's a multidisciplinary workforce working in different attitudes, different training, but looking at the same process. So there are a lot of issues in this, very complicated to handle HR in a hospital. So therefore they work in this space. So how will you allocate this space? So now currently everyone wants their own space, but you can't. Space is expensive. You can't have rooms for everyone. You have to sit in the nurses in first world. Everywhere in the first world, there's only nurses station where doctors, everyone sits there and talks to everyone and get their work done. And issues with maintenance, asset utilization, space was the work environment, health and safety. It's a very dangerous environment. How will you manage that? And then how do you manage the other support services? So hospital administrator or the health administrator should have a good understanding of all support services and the space. You can't just say it's done by the manager. No, you have to look at beyond the facility manager, because you are responsible at the end of the day. Human resources, of course, it's a very complicated issue in managing human resources. You must have had a insight to this, which I will also have a module on this for you to have a look at it. So we do different planning for HR. Just get into one area which is important. That is job design. Once you know what type of a resource that you need as HR, once you do the process design, once processes are done, we can have the unit organized as per how many patients, how many staff members you need at what level. That's called a unit design. You keep the HR into different levels. Then now you know your department how many you need, because you have done the process analysis, and then you put the standards how they should work, and then give them what they have to do. For that, you have to do a thing called job design. Unit, of course, if you look at the unit design, of course, a unit has to be, you are placed in that particular unit called organization and structure. But it doesn't mean you are stable in one. When the patient is going to die, you are not going to be as a reception. You have to get out of the reception and go and work in other, support them. So they should know the basic CPR, anyone working in the hospital. So there will be agile structure. People can be moved into different directions. And of course, the lean structure. You don't have many staff members working in one place. Not going to be a fatter. Make it linear, and then faster patient process. Support the faster patient process, because the staff is aligned to do that. And there's safety, minimal risk to the staff and the customers. So that's a unit design has to be there. HR unit design is you keep the HR human resource in different places. Then you create the standards. There are general standards how much you need in a hospital, and then of course job design. This is what I want to talk to you a bit on this. Job design is, what are they supposed to do in that particular unit? What are the knowledge that they have to have? What is the skill that they have to have? What is the attitude that they have to have? Are they going to work on negative or positive, or aptitude? Are you going to keep them there for long years, or can they move into a different higher level or parallelly in another department? So that's aptitude. So basically what we do is, first to design a job, you have to do a job analysis, then you write a job description, and you write job specification. To analyze a job, what we do is, if you're a receptionist, as I told you before, what are the knowledge that they have to have? They have to have a good language competency, right? They have to know what are the services available in the hospital, who are the doctors who are going to come, and basic CPR, the knowledge on identify patients, bad patients in front, and the skill, communication skill, typing skills, skill levels, and attitudes, positive, smiling, always bubbly face in front of the reception rather than just having a horrible face. That's the first contact in the hospital. So therefore you have to have a one who's smiling, and then of course that kind of attitude and aptitude. And they should be able to, as I told you before, move away and then support in a CPR or identify a bad patient. Attitude, aptitude. So therefore, you write down those what are the components of knowledge, skill, and aptitude you need. Then you write it down. It's called job description, right? And then you summarize that as a job specification. So you have general ones in any job description, JD. You have general stuff, and you have a specific one. So here you write more specific ones as well. So once you do that, I'll skip this. Look at the equipment. You have medical and non-medical equipment. They're capital in nature, very expensive. Lifetime, there's a lifetime for all the equipment that we use. Need to replace on and off. There's a software. It's very important to look at the software. Hardware is hardly any now. It's more software is controlling all the equipments now. Handling is very important. Train people on that. And utilization, you'll have to have a forecast. And there are supplies that are need to run the equipment. The maintenance and service agreement, that's a different topic altogether. Then there's a lead time if you want to order something, it takes time, right? Basically, it's handled by the agency. Supplies also no different, medical and non-medical. There's costly. Look at the quality and the efficacy, whether the drugs are working, and storing capacities. You will have to know. There's expiry of drugs. Storing needs different conditions. Estimation and forecasting is important, and management of supply chains, different models. And today we use mostly IT, these different systems, and they're called just-in-time. It's difficult in hospital to have just-in-time, but still you need not to store everything. It's very costly if you store them. Drug formulary, importance of drug formulary. Please read about this. There are different presentations on organizing a drug formulary. Is an important element and responsibility of a medical administrator. Drug formulary is a list of essential drugs that you use in a hospital in order to maintain the efficacy, the cost, and the quality of the drugs, as well as removing the wastage and then controlling the whole efficiency of the supply chain. Information management, that's the most important management. Use of a hospital information systems. You have a module, I suppose, to do this. And then how to support the support care management is the human resource, supply chain, facility management, financial, all that is. And then of course the clinical services management. How will you monitor mechanisms, and how will you use those information for planning and forecasting methods, and of course that is useful for quality and financial audits. So once you do that, it's a matter of organizing controlling the whole process. For that you need a policy structure. So you need initially you have a strategic objectives, long-term objective. You have a short-term objectives as well, and then typically there's policies and protocols for clinicals and support services. Policies are broader umbrellas in either maybe a hospital or the unit level, and then you have a standards of each process that we do. There are national standards, international standards, organizational standards for managing patients, managing support services, and there are protocols like a procedure level. Many protocols will be together may form a policy, right? There are life-saving, cost-saving, and the monitoring feedback is very important in this policies and protocol controlling this. Let's look at the tools and techniques that are used to improve the operational management. As I told you before, there are hospitals are faced with multiple pressures, increasing patient loads, operation costs are going high, there's shortage of health staff, limited hospital facilities, a reduction of the profit margin, and then of course hospitals there are fixed costs continuously, but you have to consider to replace some of the equipment, etc. So it's a costly and high risk environment. So basically, what we do is we use techniques and tools to minimize these particular risks and cost improvement. So basically, there are roughly, I put up about 6 tools that you can use, like TQM, BPR, constraint management, lean process technology, Six Sigmas, and patient risk management. TQM is a quality management process where we really look at continuing improvement the services, and then because of that you can you reduce the wasteful practices. In BPR, of course, you re-engineer or do the within a specific time frame. You organize new methods, new processes, new layouts, and then there will be dramatic improvement of the efficiency of the processes. And constraint management is a very important one. You diagnose when you have the process what is the weakest link that you have. Constraint management is another module altogether, but you identify the bottlenecks, the weakest links, and then you use logical tree diagrams in order to organize this. Then lean management technology, it's called a Toyota system. So basically, you don't allow, when the process move in, you don't allow it to stop. You just continuously have the process. If you stop it, then more and more patients will be stagnated in that place. So therefore, lean is you have a very lean process rather than fat process. Six Sigma also another quality improvement it's a combination of re-engineering, balance scorecards, voice of the customers, different techniques. This is the important one that I would like to just to spend some time with you. One thing is managing risks of hospitals is important. Not many risk managers are there in our part of the world, but it's important that there are loads of risks. You can, like a business risk, there are health risks. How will you manage health risks? For that, you will have to have a risk analysis has to be done in the. It's ideally from a clinical process as you can do it, and then you risk reduction by a risk mitigation. So basically, in any risk, if you identify, there's a probability of having the risk. What are the chances of you having the risk? Then second one, if you have that risk, if it happens, what's going to happen? What's the consequence? What's the effect? So these are the two things that we look at. And I'm just given a basic one in administration. Unable to maintain high customer services. Consequence is very high. Likelihood, moderate. That's the probability. And then we grade the risk level, major, significant, and minor. For example, pharmacy, medication error. The consequence, if we have that, it's very high. But the likelihood, the probability is unlikely they do a mistake. But risk level is significant. So this is the risk register. Each unit, once you do these processes, you can identify that at the functional level, activity level, task level, what are the risks that are involved. And then you can prioritize the major ones and then put it into a risk register. So similarly, you can do that. Then finally, what you can do is risk mitigation strategy. What are you going to do that? What are you going to do? What are the solutions for this? Right? Long patient waiting time. What are the? Can you change the process? Can you align the change? Can you look at the tools that I mentioned before and then reorganize this to make the process more efficient and effective? This is another activity you can do. You can organize a clinical services for 100-bed multi-specialty hospital, right? First describe the services, then do a process analysis, then identify the process techniques of each of the unit, map it, and then develop the strategies to encounter what are any other problems that you identify in this process. Thank you.